Alert Medic 1 respond. Box area 19
You're listening to the Alert Medic 1 podcast, the premier emergency medical services podcast with your hosts Mustafa Siddiq and Ken Sanner.
Hello and welcome back to the Alert Medic 1 podcast. My name is Mustafa Siddiq. Ken's not able to join me today. I'm continuing my series with JR and Jeff as we continue our conversation from last week from Emmitsburg, Maryland. If you didn't listen, go listen to that episode first. But just a quick recap, we're here in Emmitsburg, Maryland as part of the Emergency Management Institute's Basic Academy. And we're continuing our discussion about, the human factor in EMS, right? And difficulties we have with, some of the systems, some of the, the patient relationships that we, build, and how to, mitigate some of the issues that we have. So, JR works a lot with a lot of Native American tribes. Jeff is from Missouri, city of Riverside. Yeah. And so, Jeff, you were talking. I mean, we can maybe start with the education piece. I think that would be good. You mentioned, before we started recording that a lot of times the getting the resources, getting everything, the things that our patients need to thrive. What JR was talking about has to deal with education, and I like that topic. So can you expand on that?
Yeah, so, when we start to look at our problem populations and what we're looking at I feel that we do a disservice not just to our providers, but also the community and the amount of education that we're really putting out. And I understand that hospitals are really starting to look at readmission issues and stuff like that because of insurance payments from Medicare, Medicaid. And I know that they're really starting to try to hit a lot of those problematic patient groups, the COPD, the emphysemas, the ARDS, and so on and so forth, and try to increase the education as well as the diabetics. I can't forget the diabetics because those are such huge population groups. But, the other things that I see that we are missing the mark on is as EMS providers from all points is that, when we're going into these patients' homes or their areas, and we have the opportunity to provide base education with the comfort and finesse and by actually showing some compassion, that I feel that we could probably change a lot of people's lives just by them understanding that we care and that we're there to help. And that help comes with education is hey, this is what we need to do to help get you the help you need. And that education might not be the provider saying, I need you to do this, this, and this to make this change. This education might be, hey, we have these services available that you might not know about. What would you think about us helping you getting in contact with a social service provider or, a secondary service provider? There are many faith-based groups, hospital-based groups that now have meetings on how to help take care of each other, and they actually provide mentors and different venues to visit to help talk about the problems that they're dealing with, to help talk about some of the questions they have with their medications and stuff that are not being covered by a continually bombarded service which comes in the ERs, because we have a lot of patients now that are using ERs as their primary care providers. And my wife is a nurse practitioner, and she continues to see this over and over and over again. She sees the same patients, and when she talks to those patients, they're like, well, I can't get in to see my doctor. I only get to see the nurse practitioner. Well, these are still medical care providers, and they can provide those services. And I think that as EMS providers, we really need to start to focus on, hey, listen, these are professionals and these are programs that we can get you help in. And I really look forward to hearing both of your sides on this and what you think that we can do better about helping educate that growing patient population that feels that we are the answer. Calling 911 is the answer to their medical problems, and it's just not. It's not in any way, shape, or form ever going to be the answer to those patients' medical problems.
I think you're absolutely right. It is also what we provide is part of the solution, but it is not the answer, because usually the population that are suffering from all these different ailments aren't aware of what is available to them. But let me step back a bit before we get to that point of educating. And in order to do that for a tribal community, you're going to be faced with challenges, which might be, I don't want a non-tribal member talking to me or treating me. So you have to really build those relationships so that you can have that conversation with them after a few times, and you're seeing that this is not getting better and it's getting worse. And it goes right back to the customer service. How are you treating these individuals? Because the tribal nations are very proud people, and they want to be respected. And if you don't show up with respect, you're going to hit the brick wall, because they're tough and they don't need what you got. But if you do build a relationship with your customers in the community you're serving, then you're going to have the positive outcome when you start educating them on what is available to them, because some of them may not know.
So I definitely agree. Like, education is key, right? But I wanna get back to what you said about you have to, they're apprehensive, and I think that what you said about the tribal leaders, I think that can be superimposed on many different, cultural groups, socioeconomic groups. But what's the first step to building that bridge, right? Because you said you have to get buy-in from them, right? You have to earn their respect. But what's this first step of earning their respect?
Well, I would say that listening and not just talking, okay? You have to show them the respect by listening, not interrupting them. But I think that's more on the emergency management side at that level. You don't just get to walk up and talk to a tribal elder or any of the council or anything just to do it. You're interacting at your level. So I think what you need to do as a EMS provider is work with the people, work at that level, and then eventually you'll build yourself up. Okay, so really, I'll give you another example when you're talking about tribal elders. Let's say I had this conversation with a friend of mine who is tribal, working for an organization that is not tribal. And they're trying to bring in services, and she's a very genuine person. So she has the tribe's best interest, because their infrastructure may not, because all tribes aren't the same, so their infrastructure might not be able to support what they need, and they can provide that service. That being said, though, when you send people that have no concept of the Native American culture, and specific to the demographic of where you're showing up, you're going to fail horribly, because a lot of people that don't live or have not worked for a reservation don't understand the respect part. You wait till they're done speaking, okay, and you speak to them with respect. They're not a politician outside here. They're actually someone that everyone will respect within their community, and you have to really listen. You have to listen and go break bread with them. You don't just show up and say, here, I want to show you this. You go and you meet them, and you meet people that may know someone that has that relationship already built. And if you build the relationship with someone, like, for example, here, well, that person will help bring you into that demographic, and then you can build from there. but you got to be ready to go knock on doors. You got to be ready to, you got to sit down. You got to be down to earth because, that approach has been done for a long time and it has failed horribly.
And what an epic concept you have right there, JR. I mean, the building of relationship and getting back to that building of trust between not just the providers, but the community base as a total. We're talking about not just us, but we're talking about our leaders from both a provider standpoint and a community standpoint, and getting back to the base of taking care of those that look to us for care, and to build trust, to break bread, and to be respected and give respect in those circles is just a novel concept that I think we've really lost. And by doing that and building that trust in our communities by emergency management, I love how you brought the emergency management point in there. And, when was the last time that you saw any type of program called Faces of Us? When was the last time that you saw your communities truly going out there and selling themselves as trustworthy providers, and I think that we've totally lost that concept for about the last 50 years. Nobody works in the same town that they live in anymore. Mm-hmm. And so a lot of those that you were talking about are coming into these communities and don't have any true community buy-in.
Right.
And how can you serve a community that you don't have true community buy-in? I'm not saying it's not possible. I know there are tons of providers out there that would love to live in the communities that they work in, but they can't afford it because we still miss the mark on the pay stuff, but that's another conversation for another time. But I feel that even getting your crews out in the community to events, to build trust, to build that relationship with those, by showing up at the senior breakfast and showing up at community events and stuff like that, and eating in the community that they're working in. We have a lot of departments and a lot of organizations out there that still do not allow their crews to go out and eat dinner in restaurants and to eat in the communities that they're in. And I feel that is a huge place that we could actually instill a little bit of trust and respect in our jobs by just interacting more with the customer and building those relationships.
So I love this conversation because it really puts the bill on us as leaders, right? And it's not easy, right? Because oftentimes these populations can be so hard to even bring to the table. And the insight that you guys are bringing is fantastic, especially from the tribal background, and Jeff from your leadership background. So we in our previous episode we talked about treating the troops, right, or training the troops, and then we transitioned the conversation to bringing the advocacy to them. I think what we're talking about, and you mentioned it last episode as well, the idea of community paramedicine. And a lot of times we get caught up in the metrics of, it's going to decrease, ER numbers and stuff like that. But what we really don't talk about, or at least I haven't heard, is we're bringing that human experience that to them, right? That medical experience of someone is valuing me to the point where they care about my medical, my health. And I think that's a great strategy to get that buy-in, right? To get that buy-in, that mutual trust from, as you mentioned, Jeff, individuals who may not have a lot of, a lot of skin in the game when it comes to the community that they serve. So I started as a volunteer in a community that I knew nothing about, right? So I started because I went to the university in that first year. That's where I started as an EMT. And only recently did I join as a volunteer at the volunteer fire department where I grew up at. And it's a totally different game, right? It's a totally different game. And but that doesn't, I serve the patients the same way. But it's totally different when the people that you're going to, you understand where they're coming from, right? So I think it's a keen balance of understanding your patient demographic and their life experience, their human experience, but at the same time having the empathy to actually bridge the gap.
Right. I think you have to, as an individual in this profession, check your moral compass, because regardless of whether you live in the community or not, you should treat your patients as if you do. And remember to treat the patients like they're your own grandmother. And, that right there really sets the tone for the expectations of the staff that is providing that service. And if you lead by example and correct, you're going to have a better relationship with the community, because you're building the trust and you're building the respect. And now the doors are open, and now I will listen to what you have to say, because I know you're really here to help me.
And that's just, that's profound in today's society. It really is that to sit there and say, these morals and ethics that we continue to have a discussion about today, where did we lose them? And how did we lose them in our leadership? And, where did we go wrong in instilling these in our employees? And then giving back to the community that way. I mean, that's asking a lot for a person, is to change their morals and ethics to meet your standards. And I think that goes to the point is that where are your mission statements? Where are your vision statements? Where are the leaderships in showing that they are pushing that, as well as living that, as well as making sure that they are expressing that to those around them? And, when those leaders get out into the field and are showing their subordinates, or those crews, that, these are the real morals and values that we are going to push forward. And I'm going to show you that I can do them, and I expect you to follow. But once again, that comes with that follow me leadership style that in some places just doesn't exist. And, we were talking just a second ago about the community paramedics, and and the change in psychology from being emergency medical responders or 911 responders to going to that more overview care system. That is a great design. It's worked for a long time in Europe. You were talking about the game. We're behind the game. Places like the Netherlands and Sweden, Switzerland, they have nurse practitioner, what the equivalent of a nurse practitioner or a doctor that is actually in a roving unit that goes and sees these types of patients that might call because they're running out of medications. And, but I think that is a broad spectrum, and there's a lot of discussion that we could have with that. But I think it all comes back to that relationship of the leader showing those in their organization that this is how we're going to act. This is how we're going to sell our business. Because once again, I'm going to say is that we do run a business, and our product is customer service. And I think that a lot of places have forgotten about that.
I think it's also important that the accountability is from the top up, in that it's the responsibility of our chiefs and deputy chiefs to not only promote the fire department with what they're doing well, but also to ensure that they're building those relationships with the people that are above them, all the way up to the tribal elders. Showing up is very important. And when you have that, you have success within your department. You create a culture that is absolutely what they're going to provide, and they're going to make sure that happens.
So, guys, I think this was a great discussion on so many various topics and related to difficult populations. You guys have any last comments that you guys can use?
Well, I feel that this is probably, for some, is probably not going to be well received, is that, we have a issue with the leadership promoting the values, ethics, and morals that the organization needs to be showing all the time. And I feel that, by bringing those community leaders to the table, and much like JR has been talking about with the tribal leaders, and breaking bread with them and starting a dialogue about how we can better serve our communities, that we fix a lot of these issues. And I think that they're fixable. I think that it just takes time, dedication, and pounding your head against a lot of walls for a while. And I think to break those walls down is the most important thing as we can do as EMS leaders in today's society. And I think once we get to that point, that we can call people by first names and have those relationships and build that system of trust, that we will find the other walls fall very easily. And that's it. That's all I got.
Mustafa, I just want to say thank you for having me sit in on this podcast that you have going here, and I think it's a great thing. I think that we can solve these problems if we create the culture that needs to be created in order to do the service that we were hired for. We all said that in our interview, that we were going to be willing to do everything they asked us. And when you're talking with the persons above you that are the decision makers, you probably should do a little less talking and a lot more listening, so that you can be effective when you're going to provide the service, because you understand what they want, what they are expecting of you, and why they hired you.
Very good, guys. Thank you so much for being on the show. So as always, folks, please give a visit to our website, alertmedic1.com. Give us all the feedback that you can. We're really trying to improve, the product that we're giving out. Not only are we trying to really dive into the clinical aspect of things, with physiology, patho, all that stuff, but I really want to have conversations like this with leaders from around the country and around the world, because so much of our job isn't the medicine, right? So much of the job is the human experience, everything else. And it's important to have these conversations with leaders from, around the country and around the world. Please follow us on, whichever podcast program you use. We're on Spotify, iTunes, SoundCloud, Google Play. Give us a rating. Follow us on Facebook, AlertMedic1. Give us, follow us on Twitter, alert_medic1. And please give that feedback. This is I always say this at the end because I truly mean it. We here at Alert Medic 1 are doing this for the EMS community, and we want to do the best we can to improve our practice and elevate the profession of all EMS clinicians. Thank you very much for listening in. That's all for now.
You've been listening to the Alert Medic 1 podcast, the premier emergency medical services podcast with your hosts Mustafa Siddiq and Ken Sanner.